Now, once the patient's been seen, we can then move on to filing a claim. Our administrative staff would work on filing the claim using the information that's provided in the patient's record. The form that they use is the CMS 1500 form. And important things to remember about this form is that it does have 33 blocks of items that need to be filled out in entirety in order for the claim to be accepted. If there's something that has been left out or eliminated, there's a possibility that the claim could be kicked out, and you would then have the need to resubmit it. So 33 blocks of items that come with 3 sections. Section 1, you can expect to see the address of the insurance carrier. Section 2 will cover the patient who's insured. And then section 3, that's going to be all things related to the physician or the supplier of services. So blocks 1 through 13 cover section 2. Boxes 1 through 33 cover section 3. Just all 33 blocks here would need to be filled out in order for the claim to be submitted properly. This is a copy of what the CMS 1500 form looks like. Remember, we're using 2 types of codes here. We're using our CPT codes, which represent procedures, and then we're using our ICD-10 codes, which are diagnostic codes. We would obtain our diagnostic code through what the provider has diagnosed the patient with and documented in the patient's record. And then a really good medical insurance biller or coder knows how to go through a patient's chart and pull out all things that we can charge for in regards to procedures that may have been performed on behalf of this diagnostic code. Very easy to make an error. Of course, we're dealing with numbers. So it is important to check all claims before they're being sent out. And keep in mind that any error can cause the claim to be rejected. Rejected claims need to be proved and validated for codes and errors prior to resubmitting the claim again. Those claims, once they're completed, are then sent over. They're transmitted electronically. That also has flexibility, can be done 2 ways. Can be done by what's called direct billing. That's insurance carrier allows provider to submit claims directly to the carrier electronically. And then most commonly used is called the clearinghouse. Now, the clearinghouse allows providers to submit all insurance claims at one time through software. The clearinghouse will then audit as well as sort the claim, so it's checking for errors. Once it has corrected any errors that were detected, it's then going to send that information over to the correct insurance company for reimbursement. So, of course, using the clearinghouse is going to decrease the amount of rejected claims.